Today, I want to talk about a question that many men quietly struggle with but rarely feel comfortable to discuss. It's about the penis size. Almost every week, someone messages me asking how to get longer, how to get bigger or thicker. I want to address these questions honestly, clearly, and with real evidence so you can understand what is possible, what is not, and what is truly safe. So before we begin, if you find this kind of open science-based health information helpful, make sure to like this video and subscribe to the channel. Your support helps me to reach more people who need clarity and confidence about their health. Now let's get into the facts. A last study of over 50,000 men found that more than half were unhappy with how they look down there. But when researchers asked the women in their lives, nearly about 85% of them were satisfied with their partner's size. That tells us something important. The way many men see themselves is often very different from how their partners see them. A big reason is the influence of pornography, which shows unrealistic and carefully selected images. Over time, this creates a distorted picture of what normal actually is. So, what is normal? Across many studies, the average erect length is about 5.2 inches or 13.2 centimeter. There is also a wide, healthy range around this number. A penis is considered unusually small only if it is less than 2.9 inches erect. This condition is called micropenis, which is extremely rare, affecting about 0.14% of men. Most people watching this video do not fall into that category. What's far more common is something called small penis anxiety. This doesn't mean a man actually has a small penis. It means he believes he does. Some men think about this for hours every day. For some, the worries become so overwhelming that it affects their work, their relationship, their sleep, and even self-esteem. In severe cases, it can lead to depression or thoughts of self-harm. This is real and it deserves to be taken seriously. Another problem is that when men search online for solutions, they find pages full of unsafe or misleading claims. Many travel abroad to or go to untrained providers for risky procedures that can cause permanent damage. I want to protect you from that. The Sexual Medicine Society of North America, the major medical authority in this field, states that treatment for length or girth enhancements are not recommended for men with normal size. Now, let's talk about what options exist, starting from non-surgical treatments because those are always the safest starting points. The first and the most effective approach for most men is psychological counseling. This doesn't mean your concerns are not real. It means the worry itself can be treated, and research shows that after counseling, majority of men no longer want any physical procedure at all. Their confidence improves, their stress level goes down, and they are able to appreciate their bodies again. If anxiety is consuming your thoughts, this is a powerful and most important step. The next group of non-surgical options include the penile extenders, the vacuum pumps, and the injections. The penile extenders are the only non-surgical method that has shown meaningful results in studies. These are devices that gently stretch the penis using light traction over many months. They require several hours of use each day, and you have to be consistent. When used properly, men gain an average of 2 centimeters in length. It is not dramatic, but it is real. However, there can be side effects to such as bruising, soreness, or numbness, and many men stop using them because they require so much time and patience. Then vacuum pumps are often advertised for enlargement, but they do not increase the length. They can help with erection, but not the size. Then penile injections are commonly seen online, but I want to be extremely clear here. Do not inject anything into your penis. Many of these substances can cause severe complications, including permanent disfigurement, scarring, and problems that show up even decades later. The risks are simply not worth it. Now let's look at surgical procedures. Several surgeries have been attempted over the years, and one of the more common ideas is cutting the ligament that anchors the penis to the pubic bone. This can create an appearance of a small increase in length, but the results are inconsistent and complications are common. Other surgeries use skin graft, fat, and even rib cartilage. These procedures can lead to poor results, infections, deformities, or loss of functions. So most importantly, the research behind these surgeries are weak. The satisfaction rate is low. Because of this, no major medical organizations recommend these surgeries as routine treatments. The only time surgery should even be considered is inside a properly supervised clinical trial where a safety board oversees every steps, record the complications, and make sure the patients are protected. So what is the bottom line? Most men who worry about size are completely normal. The best first step is addressing the anxiety itself, especially if it takes off your thoughts or affects your daily life. If you truly want to explore physical options, the only method with consistent evidence is penile traction therapy, and even that requires time and commitment for small changes. What I don't want is for you to risk permanent harm, losing sensation, or developing scars, or hurting yourself in the pursuit of a size that is already normal. Your sexual health is not defined by a number. It is defined by confidence. It is defined by communications, emotional connection, and the way you feel in your own skin. You deserve to feel secure and informed and not pressured or misled. Thank you for spending this time with me today. If you found this video helpful, please like the video, subscribe to this channel so you don't miss future topics that can help you take control of your health. I appreciate you and I'll see you in the next video. Thank you.